What's your emergency?
I need somebody at my apartment. My son is overdosed.
Is he breathing?
I don't know. Is he not breathing? Is he breathing, Mark? He's not breathing. Please, he's not breathing. He's not breathing.
Stay on the line with me. Just stay on the line. Do not hang up.
Brendan, please. Please, help me, Jesus, please.
Hello? Okay. What's going on? Is anyone trying CPR? Is anyone attempting it?
No. He's cold. He's stiff.
A 911 call because someone is down on your campus. As a former high school principal, I know it's a call you hope you never have to make. Unfortunately, because the opioid crisis, what was once a possibility is now a reality. An overdose could occur on a school campus, and personnel must be prepared to respond. Hi, I'm John Akers, Executive Director of the Kentucky Center for School Safety. So school safety is a daily issue that ranges from classroom management to crisis situations. Because our schools are often gathering places for sports, academic events, community meetings, there's a great likelihood that an individual who is currently using opioids may be on school property and could suffer from an overdose. That's why our center believes it's critical to provide schools with information about naloxone and medication designed to rapidly reverse an opioid overdose. We are committed to making our schools safer. Being prepared to respond to an opioid overdose is just one way to ensure school personnel effectively respond to emergency situations.
Thank you, John. Naloxone, sometimes referred to by the brand name Narcan, is the first line of treatment for an opioid overdose. Hello, my name is Dr. Connie Gail White. I'm the Senior Deputy Commissioner for the Kentucky Department for Public Health. The Kentucky Department for Public Health serves as the state's coordinating entity for naloxone distribution. All school staff, including those in extracurricular programs, should be trained on how to recognize the signs and symptoms of an opioid overdose and to administer naloxone. Now, this is not a training video, but I wanted to take the information that you already know and put it together for you to give you a picture of how to identify an opioid overdose and what to do if that happens. Opioids kill by stopping the person's ability to breathe, leading to no oxygen going to the brain. So how do you know if someone is experiencing an opioid overdose? Well, the symptoms of an opioid overdose that would require the use of naloxone can include extreme sleepiness. You're not able to wake the person up by yelling at them or rubbing really hard on their breastbone. They could have trouble breathing, shallow or very slow breathing. Their fingernails can turn blue or purple, or the skin around their lips can turn blue and purple. They may have pinpoint pupils, which means the black part of the eye is really very tiny, or you might notice that their heartbeat is really very slow. Now, they may not have all of these symptoms of an opioid overdose, but if you even suspect that this could be happening, go to that distressed individual. Don't send them to their homeroom, don't send them to the school nurse alone, don't send them to the front office. Go with them and never leave them alone, and if they're in severe distress, don't move them at that time. If the individual doesn't respond to you yelling or shaking or vigorously rubbing the breastbone, you need to act promptly. You need to call or have someone immediately call 911 and activate the emergency medical services. Then you need to yell at somebody and say, go get the naloxone if you're not carrying it on your person. If the person isn't breathing at that time, then go back to your CPR skills and provide them rescue breathing as you've been instructed. But administer that naloxone as soon as you can. Now, using naloxone is pretty simple. You lay the person on their back, and then you take the spray applicator and you place that up the person's nose to the hub. So it goes into the nasal cavity, just right up next to the nose, right to the hub like this. Then you push the plunger and the device sprays up into the nasal passages, and it's absorbed by the hundreds of tiny blood vessels in the nose that go straight to the brain. The person should respond in the next 2 to 3 minutes. And if they don't, give them another spray from another device if you have one, because once you've pushed the plunger, this device will be empty. If the person does respond, then try to keep them laying on their side in a comfortable recovery position and stay with them until help does come. You may need to repeat the naloxone if in 30 to 90 minutes the person starts having difficulty breathing again. So give them a second dose of a naloxone if you have to. If after 1 to 2 doses of naloxone there is no breathing or their breathing continues to be shallow, lay the person on their back and continue to perform rescue breathing while you're waiting for the naloxone to take effect or until EMS arrives. Be sure and have someone call and notify the front desk and the school nurse. When EMS arrives, give them the individual's name and the time that you used the naloxone spray so that information can go with them to the hospital's emergency department. Of course, document the incident and complete a school incident report, but most importantly, replace that naloxone stock to be sure you have it in case you need to use it again. Naloxone protocols for the intranasal dose is located in the Kentucky Department for Public Health's Core Clinical Service Guide, or the CCSG, that many of our school nurses are familiar with and is included in the informational toolkit with this video. Remember, school personnel should not be concerned about adverse health effects of naloxone. If the person hasn't overdosed on an opioid, if they've had another health event such as a heart attack, a seizure, a diabetic coma, there's no effect on the body from using naloxone. However, if you delay administration of naloxone, that could result in a person's death. So be a part of the solution, learn how to use naloxone, and help to save a life.
By now, I hope you agree that having access to naloxone on school campuses is an important tool for ensuring the safety of students, staff, and guests. I'm Van Ingram, Executive Director of the Kentucky Office of Drug Control Policy. I believe that naloxone is Kentucky's primary harm reduction strategy for combating the opioid crisis. State agencies across Kentucky are striving to ensure that naloxone is readily available and easily accessible so that anyone coming into contact with people at risk for an opioid overdose know how to use naloxone and can keep it within reach. The timely provision of naloxone and the summoning of emergency responders can result in a life saved and the first step towards getting them into an appropriate treatment regimen. So where can naloxone be obtained? Well, naloxone can be purchased at many independent and chain pharmacies. We've provided a link in the toolkit to help you find a dispenser near you. If training is a concern, contact the Regional Prevention Center within your local community mental health center or your local health department. If cost is a concern, grants may be available through your local Kentucky ASAP board or through the State Department for Public Health. The contact information for both these boards are also available in the toolkit. Now, what about liability? In 2015, the General Assembly passed Senate Bill 192, and this law provides civil and criminal immunity to anyone and specifically mentions school employees who administer naloxone in good faith to save a life. Just as you're protected when you provide CPR to someone who may have suffered a heart attack, you're also protected when you provide naloxone in an attempt to reverse an opioid overdose. Please don't let the fear of litigation keep you from saving another life.